Good afternoon. I am Sarah Franklin with the Epilepsy Foundation of Alabama, and on the Zoom recording today with me is Dr. Katy Lalor from Children's of Alabama. She is an epileptologist, and we are here today to discuss just some options that have come upon us after the COVID-19 crisis. A lot of appointments are moving to telehealth, and so we wanted to have a quick conversation with Dr. Lalor about how that works and kind of help parents of children with epilepsy prepare for those appointments. So thank you, Dr. Lalor, for joining me.
Thanks so much for asking me to do this. We're doing everything we can to do what's best for all of our patients, but it's taking a lot of effort on our part, and hopefully everyone will have patience with us as we try to work through this.
Definitely. And I know one question that I feel like people are calling our office with is, if I have an appointment coming up with my neurologist or epilepsy specialist, what are my options?
Yeah, so different offices have slightly different procedures that they've developed, but in an effort to try to keep everyone safe and properly social distanced, we are, and we're benefiting from certain changes in regulations that have occurred since COVID-19 has appeared. So we are able to do a lot of in-home video clinic visits. And we can also do clinic visits on the phone if video is not an option. And we can still see patients in the clinic if absolutely necessary, but we're really trying to limit that just to keep everyone safe. So the video is really what we're trying to do right now.
That makes sense, and that's good and encouraging. How do I know, this is a question that maybe a parent could ask, how does someone know if their child needs to be seen in the office physically or if they should do telehealth?
Yeah, so the best person to answer that question is really your provider, your physician. We are trying to go through all of our clinic lists, I think, and determine who we think is appropriate to be seen on the video in the home versus who we might need to see in the clinic. And we are trying to contact everyone, but it has been a rapid change. So if you still have questions or haven't heard from your provider, then definitely, call the office. And it's really helpful to us too to know that you, whether or not you have the capability to do the video conferencing as well.
And that brings me to my next question. What technology is needed to prepare for a telehealth appointment?
Yeah, so in order to do the video appointment, you need either computer or phone that has video capability, so a camera and a microphone, and then of course a speaker. And then also a hopefully relatively stable internet or cellular connection. If you don't have these things, again, we are able to do phone-only visits. It's not ideal because we would like to be able to see the patient, but if you don't have video capabilities, we'll work with you.
Okay, great. And as far as preparing for a telehealth appointment, what are some things to make sure to do right before the appointment?
Yeah, so the way that it's often working is that you get a link in your email to be able to join the video clinic visit. And so trying to make sure you see the link and maybe check your spam folder if you don't see it. Find a quiet place where you can have the visit, where the patient will be visible easily, and where you hopefully have access to the internet or kind of a good cell connection. And then other things to think about, we are trying to make this as much of a normal visit as we can. So, have your medications or a list of medications handy so we can go over them with you. Have a list of questions, especially with the complications of and sort of difference in the video visit. I worry things might get left off, or you might forget things that you were hoping to talk to us about. So writing those down would be helpful. And then if you happen to have a scale, getting a recent weight is really good, especially if you haven't seen your provider in quite a few months and you're a pediatric patient who may have grown. A weight is really helpful for us to adjust medications.
That's a great point. And I know, as far as like you're an epileptologist and your neurology team at Children's of Alabama, like I know, keeping a good count as far as seizures, how often they may be happening. There are so many ways to keep track of those, but if you need a good way to track them for your team at Children's, I know epilepsy.com, you can look at My Seizure Diary. That's an app that you can download on your phone, or you can print it out if you want to do it on paper copies, but that's a great way. And Katy, your team might have a great way too to keep track of seizures that you recommend specifically for your patients.
No, My Seizure Diary is great. There are a few other apps. There's one called Epi app. So you can search whichever app store you use for epilepsy, and quite a few will come up, or go to epilepsy.com and find it there. Those are really helpful and can keep track of your medications too, so that you always have a list.
That's great. Great. And then if another caregiver in a different location wanted to join a telehealth meeting, is that possible?
Yes, actually we can, just as you and I are here talking on this Zoom meeting, we can actually add in a third person, or even if necessary, a fourth person. So if there is another parent or another caregiver who wants to be a part of the visit, we can help you with that. We just need to know in advance so we can send the invite to all the right people.
Great. And then when it's appointment time, do we just join right then, or do you suggest logging on a few minutes early? What are your suggestions upon that?
So the way it works, at least for us, and I think most places, UAB and most other places, there's a virtual waiting room. So you can, and I think should, log on at least 5 minutes before, make sure your connection is working. And if you can't find the link or can't get a connection, please do call the office. There's some troubleshooting things we can do with our coordinator to try to help facilitate the visit before it starts.
What about, is there any paperwork required that parents fill out and get to you before a telehealth visit?
Yeah, so we do have to have consent for these visits. We need an agreement that says that you're okay with whatever normal charges may be incurred, and then also sort of that you're okay with talking to a provider on the video. We can do this verbally, but we are trying to get it out as a paper form to everyone's email. So if you do get that and send it back, we'll have it officially in the chart, but if you're not able to, we'll do it verbally during the visit. We're working on getting the normal sort of intake sheets that we have patients and their families fill out before our clinic visits. We're working on getting those to our patients, but it's still in process. But anything that we do send to families, it's really just to help us make the visit more efficient and try to do the best we can for the patient. So if we do send you anything, we encourage you to try to get back to us before the visit.
Okay, great. And what about, along with that, copays? How are they handled and paid, since we aren't coming into the office physically?
Yeah, so there traditionally is still a copay. Some insurance companies have changed how they're implementing these copays for the telemedicine visit, given the difficulties that everyone is having right now. So definitely check with your insurance provider if you have any questions. They'd be able to be more specific about what the copay might be. But if you do have a copay, it will be mailed to you rather than paid at the time of the visit.
That makes sense. That's good to know. Okay, great. And if someone has additional questions about seeking medical advice for a loved one with epilepsy, especially over the coming weeks during the global pandemic, what number should they call if they typically see a neurologist or epileptologist at Children's?
Yeah, so definitely can always call our clinic. The number is 205-638-2551. It has recently changed, and the old number will still work too, but that's the new number. People are always in the office still. We're also social distancing, but we have people available for you, for all of our patients. If you have been referred to the neurologist, we are working on getting those patients in as well, but talk to your primary doctor if you have questions until you get an appointment. And then, of course, epilepsy.com, the Epilepsy Foundation, have a lot of resources for patients with epilepsy kind of in this time, and I think have put out some good information questions that patients may have.
Yes, thank you. I know on epilepsyalabama.org, our specific website for Epilepsy Foundation of Alabama, we put up a fact sheet about COVID-19 and epilepsy. And then even beyond the pandemic, it has great information, just questions that you may have about seizures and epilepsy. And then I really encourage you to visit that. And we have, if you're on social media, we're on Facebook, Twitter, Instagram, LinkedIn, and even have a YouTube channel. So that's where we'll put this recording that we're doing today. And Dr. Lalor, I just really appreciate you taking time to do this and help parents understand what to expect with telehealth. And then I just want to close. I think it's always important to know, when should we know, like, I do need to go to the emergency room for seizures and epilepsy? That's always a question that comes. What is typically your advice on that as we close out today?
I think anytime you're concerned about your child or a loved one, you can always call 911 and should. EMS can help you in your home or transport you if needed. If you feel comfortable though, you can always call our office, or whoever your provider is, you can call their office and we can walk you through what to do, how to get through, a certain situation, and whether or not you should come in, especially given the concerns with coronavirus.
Well, thank you again for everything and just for helping. This really helps. I hope a lot of parents feel at ease and answer some questions that they have about telehealth. And I hope you have a great rest of your day. Thank you, Dr. Lalor.
You too.